Hello, I'm Dr. Craig Childress. I'm a clinical psychologist in Pasadena, California, and I specialize in working with children and families around issues of attention deficit hyperactivity disorder, parent-child relationship problems, angry, oppositional, defiant children, marital problems, things like that. In this video series, I've been discussing a particular type of parent-child relationship problem that I refer to as a parental alienation dynamic. In this video segment, I'm going to be discussing the treatment needs of the child relative to resolving the alienation processes in the family, with a specific focus on the child's primary DSM-4-TR diagnosis of the shared psychotic disorder, the shared delusional disorder. And in this video segment, I'm going to be discussing the nature of that delusional disorder. Now, on the surface, the delusion is that the targeted parent, the delta parent, is somehow being abusive to the child, when in reality, when we examine the parent-child relationship, the parenting behavior of the targeted delta parent is entirely normal range. There's nothing aberrant or problematic regarding the parenting behavior of the targeted delta parent. In addition, when we examine the parent-child interaction sequences, it becomes evident the child is not the victim of abuse, but is actually the perpetrator of abuse. And when we take that information back to the alienating beta parent and present them with the specific information about how the child is provoking the conflict and how the child is being abusive towards the targeted parent, the alienating beta parent simply cannot integrate that information and continues to maintain that the delta parent is somehow being abusive to the child. Now, that is the surface presentation of the delusion. However, the delusion is much more complex than that, and it involves a transgenerational transmission of trauma, whereby relationship patterns from the early childhood experience of the beta parent are being transferred up into current relationships within the family. And the origins of the alienation process lay in the early childhood relationship of the beta parent as a child with their own parent, the alpha parent, in which the alpha parent was variably and inconsistently nurturing and extremely hostile aggressive, so that the beta child could never anticipate whether they were going to receive the nurturing relationship from the alpha parent or the hostile aggressive relationship from the alpha parent. And this inconsistency produced an intense amount of anxiety for the beta child. And in an effort to manage that anxiety, it became very important for the beta child to resonate and attune to the inner psychological state of the alpha parent. As long as they could enter a resonant state with the alpha parent, they could predict what the psychological state of the alpha parent was and whether they were going to receive the nurturing relationship or the hostile aggressive relationship. And if they could predict which relationship they were to receive, they could then prepare for it. If it was a nurturing relationship, they could relax and become vulnerable. If it was a hostile aggressive relationship, they could close down and set up psychological defenses. And so as long as they resonated with the inner psychological state of the alpha parent, they could predict and manage their anxiety related to the relationship they were to receive from the alpha parent. In addition, if they could resonate with the inner psychological state of the alpha parent, then they at least had the potential to somehow alter or change what they were doing to meet the needs of the alpha parent and therefore acquire the nurturing parent. So maybe they could somehow become who the alpha parent wanted them to be and then acquire the nurturing relationship. On the flip side of that relationship was that psychological separateness produced an intense amount of anxiety because they could no longer predict whether they were going to receive the nurturing parent or the hostile aggressive parent. And so from this relationship pattern came a central organizing construct for the beta child and later the beta adult and parent, which was that psychological fusion represents safety and psychological separateness represents danger. And because psychological fusion represents safety, the child and later the adult and parent will tend to enter that resonant psychological state with others, and because that represents safety and that reduces anxiety. And so the child and later beta parent and beta adult tends not to bring authentic self into relationship. And so there are very few opportunities to modify the relationship meanings of psychological fusion represents safety and psychological separateness represents danger, because the beta child and beta adult don't enter psychologically separate relationships, or when those do occur, they tend to flee them, and so they don't remain in them long. So there's no opportunity to modify these trauma networks. So they essentially move from early childhood up into the current relationships unchanged. And so when the delta parent becomes psychologically separate from the beta parent during the course of their marriage, that reactivated these early childhood trauma networks for the beta parent of psychological separateness, producing intense anxiety and signaling danger. Anxiety signals danger. And so with the reactivation of these trauma networks, the beta parent then experiences this intense anxiety associated with the delta parent. And they then need to attribute some sort of meaning to this intense anxiety. Why am I feeling so much anxiety associated with the delta parent? And the attribution of meaning that they develop is that the delta parent is somehow dangerous, and that the delta parent is therefore somehow abusive. And that's the origin of that abusive component of the delusional disorder. However, with the reactivation of these early childhood trauma networks, the delusional disorder is more complex than simply that the delta parent is somehow abusive. With the reactivation of these trauma networks, the relationship representations also become reactivated, so that the general theme of abusive parent, victimized child also becomes active and is replayed in the current relationship patterns, as well as the relationship or the psychological representations for the various participants in the relationship patterns. So when the trauma network is reactivated, the alpha parent representational network is also reactivated and becomes psychologically equivalent and overlaid with the representational network for the delta parent. So the delta parent becomes the alpha parent. In addition, the representational for the network for the beta child is reactivated, so that the beta child and the delta child representational networks are also overlaid and become equivalent. So now the delta parent is the alpha parent, the delta child is the beta child, and so when the beta adult is responding to the various relationships, they are actually responding to early childhood relationship patterns involving the alpha parent and themselves as a child. And it is this reactivation of the childhood or trauma networks that is the actual delusional disorder, and the imposition of these relationship patterns on the current family relationships represents the delusion. The child's shared psychotic state, the shared delusional state, represents the child's participation in this reenactment scenario, or the reenactment narrative, whereby the delta child is now serving as a representation for the beta child, the victimized child within this pattern of abusive parent, victimized child, and the beta parent represents the all-good, saving, protecting parent, who then protects the victimized child from the abusive alpha parent. And so it is the reenactment of these early childhood relationship patterns that is the delusion, and the child's shared delusional disorder is the child's participation in this reenactment narrative.